Hey guys, so I'm gonna show you some pictures and tell you about my scoliosis operation and yeah, how I felt. So this is what I was basically looking at every day after the operation because I had to stay in bed for 2 weeks and I couldn't move a muscle, literally. I was just, I was like dead. Yeah. This is how it looked like sometimes, I think during nighttime actually, when I was supposed to sleep. But I couldn't sleep. I couldn't sleep for any hours, any minutes actually. If I tried to close my eyes, the pain in my back would wake me up. It's pretty horrible. And of course, I had some kind of Russian TV as an entertainment, which only had 3 channels, and I didn't understand the language at that time. So yeah, uh, I could drink something sometimes. Great. That's how I looked like when I was 15. A young 15-year-old. Just turned 15, basically. If you look closely, you can see my nose being stuffed up. So basically, this is where my puke came out. Because I wasn't able to puke. I had no contracting muscles, whatever, that would allow me to puke. And my hair was completely dirty. If I touched it, it was like wax or something. And yeah, puke was constantly coming out. If you look here, it's constantly coming out. So that was horrible. Here was where I slept. Yeah, really, really luxurious. And this is what I have. I still have this, but we fixed it kind of. So I think it was altogether around 50 degrees. I'm not sure. As you can see, there's a curve here. There's a curve here. So it's like an S. See? It started hurting when I was around 14 years old, and I never knew what it was. But as you can see, on the left side, it started hurting on the left side, and started kind of pinching or something. So finally, I went to the doctors, and they said I got scoliosis. Do you want to train, build up your muscles, and uh, you know, live with it, or do you want an operation? And I said I want an operation. And apparently, I grew by 5 centimeters, which is around maybe 2 inches, which was a good surprise after the operation, of course. Yeah, this is once again the same thing. As you can see, I was really, really helpless. This is how it looked like after the operation. I probably took a shower or something. Notice this one. Yeah, I had acne on my back, already looking horrible. Plus, um, I still have the scar, of course, but they kind of closed it with these. I don't know the name of it, but you just kind of, you know, and it really hurt. Some of them got infected, I think. But it was great. It was great. Oh, and here, basically, since the surgery was done with a robot, they had some coordinates that they're gonna cut, and they started off wrong. So yeah, but it doesn't really matter. It got fixed, and it got fixed really well, actually. This is how I look like. I think I took my first steps after 2 or 3 weeks, or even 4 weeks, and I couldn't move, no muscle whatsoever. Um, I was literally like a zombie, like a Frankenstein. I couldn't move my body basically. I could just move my legs. It was pretty sad, pretty sad. Yeah, of course sometimes I got to McDonald's, nice food to cheer me up, but it's really hard to be happy if you're awake for weeks constantly. So yeah, this this is how you'll probably end up looking after the operation, taking your first steps. Some people do it within 3 or 4 days. Some people do it within weeks. For me, the recovery, not recovery, but the ability to walk again. I think I got it after 1 week, but it was a really 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 weird, unrealistic feeling that I got, because I was laying here in this bed and I was looking at the people walking, and I actually felt jealous. I felt I felt jealous of the people walking the most normal thing a human being should do, and could do, and I felt jealous because I couldn't stand up. It hurt so much. But as you can see, I'm on my feet here again. And yeah, I got some food there, and of course there's a string of hair. Yeah, it was a nice surprise. This is how I looked like, completely. This is not how I look like now, by the way. I'm a little uh, I'm a little different now. But yeah, check out the hair though, looking beautiful. All that sweat and dirt. I think I washed it like 3 days straight after I ended the operation sessions. So yeah, that wasn't too fun. And just overall, getting scoliosis was not not the best thing that happened to me. And of course, it doesn't look like this. Because these are really, really, really bad, bad, bad forms of scoliosis. I hope no one should get this. This is just brutal. But yeah, I mean, what it could do is, it could hinder your lifestyle. If your parents are professional boxers and they want you to become a boxer, you maybe couldn't because of your scoliosis. But actually, you can do whatever you want if you really want to. But there's just there's a limit to it. I've done martial arts. I've done brutal fighting. I've done all kinds of rough exercises with my back, and there's always a limit. And I still feel, I feel the metal spine in my back right now at every movement I do. But it's kind of unconscious. But yes, it is possible. It is possible to get fit. It is possible. Everything's doable. You just have to want to do it. And one more thing with getting fit and training and so on, yeah, is that it's also in the genes. Not only do you inherit scoliosis from your genes, your parents probably think that you got it from sitting behind the computer or something, but no, scoliosis actually really old ancestral disease, which you just get. You can't do anything about it. Look at this. This explains exactly what I'm talking about. One of them has it. Goes on. These woman and man, by the way, goes on, goes on, goes on. Their children's children. One of them has it. But some of them might not have it. So it's in the genes. And also, what's in the genes is, are you gonna be fit? Because some people like I just stay fit. I don't have to do anything basically, and I stay fit. But there's not many people like that, from my experience. A lot of my friends, relatives, they actually, they need to work out, do whatever to stay fit. Otherwise, they just get chubby, next level fat, and go on. But if that's what you want, totally okay with that. Do whatever you want. But what I'm emphasizing is that if you really want to do whatever you want with this condition, then I guess you have to wait some years after the operation, and then you can just do whatever you want. Of course, to your own limit. I'm not encouraging anyone, but what I'm saying, I've done most of the extreme things. I mean, if you Google Muay Thai, it's really, really, bending like that. It's brutal. So yeah, you can decide for yourself. Any questions, please ask me. I'll answer to anything, everything. Yeah, and have a nice night or day.